getting started. This is an 82-year-old who loves to garden and horseback ride, but has a terrible back. She has degenerative scoliosis, 2-level spondylolisthesis with disc space collapse, and terrible stenosis. The space for the nerve should be like this big, and instead it is this big. It's like a little trefoil. Same thing here, especially on the sides called the lateral recess. That space right here. So we're gonna do the perfect 2-level MIS TLIF. So wish me luck. Putting in some screws. You have osteoporosis, we know, but this is a good bite, probably because arthritis begets sclerosis. That's what bone spurs come from. The bones get stronger with arthritis. That was pretty dang good right there. So far, no cement needed. Oh, look at how good that looks though. Yep, your bone was very osteoporotic, so we're injecting some cement through the screws. I wish I could say I helped design these screws, but I can say that I told them that we need screws like this, and they said, yeah, whatever, Dr. Kim, and the next thing you know, they're making them. I felt a little left out, but they can't include me on everything. I get it. But I still feel left out. Because this was my idea. Globus is definitely the #1 spine company in the world. That's all there is to it. And I remember when they were nothing. They were like my pinky, tip of my pinky. Now they're like 2 of my thumbs, maybe my big toe. Oh my God, that looks good. Your bones were thirsty for this cement. Oh, it's working so well though. It's nice and thick, it's totally contained. Okay, this is L3-4, where the worst level is. Just doing the approach, using the expandable minimally invasive retractor, and delicate Asian fingers, putting in the world's most expensive bone graft. It's also the best, but the world's sexiest cage alive. Also the most expensive, but don't tell the hospital that either. Interbody expansion time. Okay, first level's done, 3-4, now I'm at 4-5. It's going absolutely, positively, perfectly, if I do say so myself. Using navigation to find the perfect entry point. Because perfect is just barely good enough around here. Picture time. That looks pretty good. Alrighty, save that, that's our baseline. Okay. Interbody expansion time. Surgery's all done. We did it through 2 little incisions, but you're going to be so much taller, straighter, stronger, faster. Oh, wait a minute. That's something else. Look at that. Shower resistant dressings and everything. So cute. We're all praying for a great result and a speedy recovery, right guys?
Yeah!